Often, children who are adopted or in foster care experience psychological or relationship problems. There are many different health and social care services available to help, and they all aim to improve the child's mental health and/or the family relationships. This study is trying to find out which type of service works best and whether these services are worth the costs and the effort the families have to put in to receive these services. We're inviting adoptive and permanent foster families to take part in this study if they were referred for support with a child aged between 5 and 12 years of age. If they decide to take part, families would be offered either dyadic developmental psychotherapy, DDP, or the services already being provided locally, which can be a range of social and healthcare supports. We call these wide-ranging health and social services as usual, SOW. A clinical psychologist created DDP as a treatment for families with adopted or fostered children who had experienced neglect and abuse in their birth families. DDP is a family-based therapy, and parents are encouraged to carry on using the techniques that they learn during DDP in their daily lives. In this study, DDP will usually be offered weekly over 6 to 9 months. Central to DDP is the concept of playfulness, acceptance, curiosity, and empathy, known as PACE. Services usually offered to adopted or fostered children aged 5 to 12 vary widely across the UK. In many areas, families receive regular support from experienced social workers, and families might also receive support from child and adolescent mental health services or from third sector organisations. If you are working with an adoptive or permanent foster family that's seeking support with a child aged 5 to 12 years of age, the first thing to do is have a look at our referral checklist. We developed this checklist with experts in DDP and with expert social workers who work with children who might benefit from being part of the study. But if you have any questions at all, or if there is anything you're not sure about, then please just ask us. Here are the contact details for our trial managers. We're really keen to talk to anyone with questions because discussing grey areas about which families are eligible and which might not be will help us give other colleagues an even clearer set of guidance. So, just to be really clear, we are looking for adoptive or permanent foster families with children aged 5 to 12 with mental health problems thought to be linked to abuse and neglect or in early life. Families who are otherwise eligible, who are deemed by social workers or therapists as not being ready to take part in a family-based therapeutic treatment. Children currently having another psychotherapy, or children who are not in permanent care. If you think you might have an eligible family, please give them one of our information packs. Please check that the family are happy for us to contact them, and if they are, the named administrator in your area will enter their contact details into our secure web system. We'll do the rest by getting in touch with the family, making sure they've had a chance to read the information, and asking any questions they might have. If they decide to take part, we'll ask them to sign a consent form and then arrange a time for them to take part in the baseline assessment. After that, our computer system will randomise them to either DDP or services as usual. We'll share this information with your team so that you can refer the family to the appropriate service in the usual way.